Good evening and thank you for joining us. We begin with unprecedented new steps to fight the spread of COVID-19. For the first time in its history, South Korea's Catholic Church canceled Sunday Mass as that country grapples with the worst outbreak outside of China. At least 65 countries worldwide have now detected the virus. In Italy, where entire towns are on lockdown, more than 30 people have died. It's one of many countries struggling to contain the virus. Ross Lord has tonight's top story.
In South Korea, the blame game is underway. Some officials want leaders of a church to be investigated on murder charges over the coronavirus. The reason? They say some members visited the epicenter of the outbreak, the Chinese city of Wuhan, in January. Then, church leaders allegedly interfered with government efforts to fight the outbreak.
코로나19 감염자 대규모 발생과 관련돼서
The South Korean health director says 2 patients who've been placed under self-quarantine have died, leading him to question how medical resources were allocated. That challenge, applying medical might properly, is a growing priority, and not only in Asia. With cases in Britain rising into the dozens, the government is stepping up its response.
What they're doing is testing literally thousands of cases. I think they've done about 10,000 so far. And as you know, we found about 35 people in this country have had the illness. And clearly there may be more.
In Italy, tourism is running dry as that country grapples with a major outbreak. Another tourism landmark, the Louvre Museum in Paris, closed Sunday. Staffers reportedly refused to work over fears of contamination. The Paris half marathon was also postponed. But hundreds of athletes ran anyway, some suggesting new rules limiting large gatherings infringe on their freedom of movement. More conspicuous are boasts of confidence, like this one from Iran's Islamic Revolutionary Guard. We will defeat coronavirus, don't worry, says this Guard official. Despite Iran's death toll climbing well into the dozens, the highest number outside China. Some neighbors have closed their borders with Iran. More signs of international inertia. Ross Lord, Global News.
Just some breaking news here in Canada. Public health officials say 4 new COVID-19 cases have been confirmed in Ontario. That brings the total number in Canada to 24. South of the border, an outbreak is growing in Washington state. Jennifer Johnson has that angle.
Officials in King County, Washington, now reporting 2 more cases of COVID-19, bringing the number of cases to 6 in the same county that saw the first U.S. death related to the virus. Officials still don't know how the man who died was infected.
We have CDC on the ground immediately to assist and support, and they're working to identify it.
But researchers say the virus in Washington may have been spreading for weeks, and up to 1,500 residents could be infected, forcing the governor to declare a state of emergency. At this Seattle area nursing home, 2 people have tested positive for COVID-19, and over 50 others are showing symptoms.
We're in the process of investigating this situation as an outbreak.
The virus is spreading to America's East Coast. Rhode Island's governor is reporting its apparent first case of COVID-19.
Be careful and be vigilant, but don't panic.
The U.S. Surgeon General is urging Americans to stop buying face masks, fearing a shortage for healthcare professionals. President Donald Trump now says travelers going to high-risk countries will be screened before and after returning to America. Still, he's facing backlash after calling Democrats' criticism of his response to the crisis a hoax.
This is not a Democratic hoax. This is incompetence on the part of the President of the United States at the expense of the country and the world.
Many experts are questioning why there still are so few test kits for the virus in the U.S. The Trump administration has given the Food and Drug Administration emergency authorization to create more.
We now have the capability out in the field to test 75,000 people, and within the next week or 2, we'll have a radical expansion.
Health officials sending out mixed messages, some urging the public not to panic because the risk of getting the virus is low, while others promising this first death is only the tip of the iceberg. President Trump will meet with major pharmaceutical companies Monday about the development of a possible vaccine, but that could take some time. He'll also meet with doctors at the Centers for Disease Control later this week. Jennifer Johnson, Global News, Washington.
Back to our top story. The COVID-19 outbreak has also spread to the stock markets, taking them on a wild ride from record levels to the worst week they've seen since the 2008 financial crisis. It's Monday in the Middle East, and already trading is down. Let's bring in Mark Yamada, an investment advisor, to talk about this situation. Mark, why is the virus having such an effect on the markets?
Well, the one thing the market really hates is uncertainty. And there's a lot of uncertainty around COVID-19. While companies are scrambling to check their supply chains, market participants don't have that luxury. We have to make educated guesses with less than perfect information. And we're just not getting enough information now.
So we can expect more losses on the market this week?
Well, you rarely want to encourage people to think along those lines, but until we have better certainty, and of course we're never going to have complete certainty, until we have more certainty, we're going to be probing for new lows. And of course the market always overdoes it in both directions, both the upside and the downside, but we don't yet have enough information to determine where the base is.
Is it fair to compare this to the 2008 financial crisis?
Not really. Very different, but equally as scary. The 2008-2009 crisis was really very closely associated with the banking structure. This is less to do with the banking structure and more to do with corporate earnings and uncertainty surrounding what has really become an integrated global marketplace. We depend on China for an amazing amount of certain elements of our goods. 80%, for example, of pharmaceutical inputs come from this particular area in Hubei, and we just don't know how things are going to change in terms of inventories.
Could this have an impact on the next interest rate announcement?
Oh, there's no question about it. I think one thing you can definitely expect over the next 5 days is either a single or concerted effort by central banks around the world to provide credit. Banks around the world are going to make sure that everybody knows that credit is available, so that because of the delays that may be occurring in the banking system, that there should be no problem. But of course, it's not an antidote to what's going on in the world, but it is a help.
Mark, thank you for your time.